Do you or someone you know struggle with excessive anxiety? Anxiety is a normal and healthy and helpful emotion. However, it is also the number one most common mental health struggle that human beings experience. Today, I want to empower you to really understand what anxiety is and what the difference is between normal, healthy anxiety and anxiety disorders. We're going to talk about cognitive behavior therapy, mindfulness, nutrition, and every area in which we have choice to actually rewire the brain and help our nervous system come into balance so that anxiety can just be one of many emotions we experience and it does not derail us from living with optimal health. Welcome to Root Cause of Happiness. I'm Dr. Sarah Bryn Morrow, licensed psychologist, therapeutic yoga teacher, and optimal wellness educator. I teach the physiology of mental health and the skills to overcome suffering at the root cause. My intention is to empower others to become increasingly resilient by understanding the many pieces of the puzzle to deep healing. Please join me as we explore the root cause of happiness. Essentially, every human being on the planet goes through anxiety at least some of the time. Anxiety is one of our normal and healthy emotions, and it's really intended to help protect us from possible threat or harm. Your brain has many functions it does throughout each day, but the number one job that your brain prioritizes is to be able to assess the environment around you and anticipate anything that could be potentially threatening to your health and safety and well-being. When your brain detects possible threat, it is wired to very quickly sound an alarm to alert you, yikes, that could be harmful, get away. And so this is what we call our fight, flight, stress response. While anxiety is normal and healthy and necessary for our safety and survival, it is also the most common mental health struggle that humans go through. We know that about a third of people will have a diagnosable anxiety disorder at some point in life, and that at least 10% of children have an anxiety disorder diagnosis. And I think most of us at least have chapters of life or certain experiences that we experience excessive levels of anxiety that are very uncomfortable, difficult to cope with, and can really cause us to have some level of unnecessary suffering. So your brain has good intentions by identifying threat, sounding the alarm, and motivating you into fight, flight, survival behavior. Typically, when we feel fear, we go into flight, wanting to avoid or run away to escape harm. But some people are more wired towards fight. So when they feel anxiety, they actually get irritable, rigid, controlling. In childhood, we often see defiance is actually a result of underlying anxiety. So we have to start to understand how anxiety shows up for each of us as individuals. Where is it helpful and something that is okay, that will just happen and pass by and not cause us harm? And where we might actually be having excessive levels of anxiety that are making life much more difficult than it needs to be. So if you would refer back to one of my original lectures about the nervous system stress response, Master Your Stress Response, in that lecture I go through all of the physiology about what happens in the brain and body that drives the sensations and discomfort when we are triggered into a stress. So if you look back to that video, you'll hear about how the heart rate increases, the stomach shuts down to conserve energy, we lose blood flow and function to the smart part of our brain, and we might feel hot and sweaty, cold and shaky, queasy, tense, restless. So we have this chain reaction of physiological changes that occur when we are in a fight-flight stress response. So the amygdala in the brain will perceive threat, it will sound this alarm, and the physiology of the body changes to save energy, redirect your energy towards strong muscles, able to fight strong and run fast, and have very quick reactions to try to avoid harm or respond to danger to increase our survival. So that's really helpful. That's what we call a real alarm stress response. When there really is evidence of danger, we want to be able to go into a quick survival reaction. But what most of us go through that is not desirable and is really unnecessary suffering in life is what we call false alarm stress reactions. So this is where technically in this moment there isn't evidence of danger, but possibly your brain is worrying. Your automatic stream of thought is full of these worries about what if this happens? What if that were to occur in my life or to somebody I love? It could be life-threatening, painful, humiliating. And so as we're worrying and imagining catastrophic type events, it can trick the amygdala into sounding that alarm, putting us into a full-blown fight-flight stress response with a high level of anxiety. And truly, we are safe in the moment, but it feels as though we are facing doom and we have a terrible sense of dread. So while anxiety is a normal emotion and actually does protect us from harm when there could be threats in our environment, what we need to be aware of is our own pattern of worry, where we get anxious and distressed when after the fact we kind of look back and go, ugh, I think I kind of freaked out. I think I overreacted. I didn't need to worry that much. I was so anxious I couldn't really cope well or function going through that experience. And so we each have typically some area in which we get false alarms. For a lot of people, that might be public speaking or social anxiety about being judged by others. I think worries about our health, our safety are very common. A lot of people have nervous feelings flying in airplanes or just being in unpredictable situations. So often we feel anxiety when we're not sure that things are going to work out okay. The human nervous system really likes guarantees, a sense of certainty that all will be okay. And there's so many things in life that there is no guarantee. There is a slight chance that that thing could happen and that terrible thing could occur. And when we even sense a possibility of harm, it can bring us into false alarm anxiety reactions. So one thing we all have to do is start to be curious about, where do I get anxious? Because while everybody experiences anxiety some of the time, the pattern, the triggers are different for each of us. And so we all have to kind of do our scientific investigation about, when do I feel anxious? What is my pattern of worried thought? Where do I feel overwhelmed, have a meltdown, feel desperate to avoid or run away from challenges? And how is that affecting my life? It might be that you have good willpower and you can push yourself to function through anxiety, but there's often areas in life where we're being held back. We've lost some freedom because of unnecessary anxiety, making certain situations just intolerable to cope with. So we all should check in and figure out, where do I have anxiety that I should work on? So one thing to start doing is to notice, when you feel anxious, what are the sensations that you specifically notice in your body? So our degree of interoception or awareness of sensation happening within the body, such as your heart rate changing, your stomach getting queasy, your muscles being tense and fidgety. We have varying degrees of this interoceptive ability of inner awareness. So one thing we have to do is be curious. When I am anxious, worried, nervous, on edge, overwhelmed, what do I feel in my body? I happen to be pretty tuned into my heart rate for some reason. If I feel my heart rate kind of beating too fast or too hard, I'll notice that sensation. It's uncomfortable. And that is my cue to go, what was my brain just thinking about? And from the awareness of that discomfort in my heart rate, it cues me to realize that I had worried thoughts just occurring, these automatic negative thoughts just popping up in the brain. From awareness, then, there's an option to be empowered to change the thoughts and to choose behaviors to self-regulate, to lower that false alarm stress response in the body. Other people are much more aware of their stomach discomfort. So we have this term of butterflies in the tummy, right? So when we're nervous, we have a big challenge coming up, often performance anxiety, we'll feel this queasiness in the stomach as digestion is shutting down. The body, with a good intention to save energy and redirect our body's energy towards survival mechanisms, such as increasing heart rate, increasing blood pressure, and powering up the muscles for fight and flight. But if you notice your stomach is in discomfort, that might be your main sensation that you're aware of that helps you then tune in and recognize, am I anxious right now? For other people, it's just they can't sit still. They might just squirm in their chair. Their hands might be restless, picking at their skin, their clothes. They might have hair habits. So some people fiddle with their hair or put their hair in their mouth when they're anxious. Some people have a restless foot or leg where they kind of jiggle and bounce their foot. And some people just can't really relax and feel calm in their body with anxiety. Some people might feel that they get flushed, that their face gets pink or hot, or they get sweaty, and kind of this overheating sensation in the body. Some people notice that they're shaking and quivering. So whatever is your pattern, that cue or the sensation in the body becomes the cue to alert you and realize, whoa, what am I feeling right now? Am I anxious? What was my brain worrying about or thinking about? Usually, thoughts that trigger anxiety are about the future. What if in the future this bad thing happens? So first we have to get to know our anxiety. What are my high-risk situations? What are the sensations that I'm aware of in my body when I'm anxious that can help alert me to the fact that I'm going into an anxiety stress response? And what is my pattern of automatic negative thought? And you might even write those things down and start to realize, wow, I seem to worry about the same 5 or 6 things all the time. Those are the things that tend to cause me to get the most anxious. So those are really helpful things to investigate. We also should look at behavior. When I'm feeling anxious, what are my reactions? So very often it's avoidance. Trying to avoid school or work or that meeting or talking to your boss or whatever might be the challenging situation. Some people avoid going to the doctor or dentist because of anxiety. A lot of people will go into conflict, and so they have that irritability and kind of on edge, they just have no tolerance for anything or anyone, and they might be in an irritable, sort of combative mood when they're actually anxious. So I'll have some lectures probably about anger and conflict and relationships and communication skills, but one thing to know is that when you are in anxiety, what might show up is anger, and we call anger a surface level emotion. It seems like we're angry. It seems like the problem is the outside world, and we're in conflict or angry about something external to us. But if we can have enough self-awareness to kind of look below the surface of that automatic anger, we might realize that we're reacting with anger because deeper down, we're actually anxious about something. I see this a lot with parents, and I've experienced it myself in parenting, that I might react to my kids, and it's not really the correct emotion. The irritability or anger is actually coming from a place of worry. And there's anxiety in parenting that sometimes leads us to kind of lash out at our kids with irritability. So anger is often our cue that actually we're anxious, and we should dig a little deeper to figure out what the true emotion is that's driving the surface level angry behavior. So we know that anxiety is common, it's natural, it can be helpful. You can imagine that for human beings that don't have much anxiety, that they might put themselves in harm's way. So if you think about a lack of anxiety around safety, that might be somebody that will do dangerous activities or take risks and seek adrenaline, kind of exciting things that other people might be able to say, I don't think I want to do that. I could get hurt. Having a bit of anxiety around your health can be helpful. If people have no awareness or long-term view about, yikes, what would happen if I keep living this way? Maybe drinking too much alcohol, eating lots of sugar. not exercising, that without a little bit of worry about your long-term health outcomes, you may not have the motivation to make healthier choices today. So anxiety is not really the bad guy, but we have to realize when anxiety is not helpful and when we're having some type of false alarm stress response that's not really based in evidence. So one of the cognitive exercises we can do is to say, I'm feeling anxious. I know the sensation of anxiety in my body. I can tell I'm having worried thoughts. And then we look for evidence. Is there any evidence right now to support the need to feel anxious or unsafe? And when we can identify really there is no evidence or statistical likelihood of that thing happening, we can kind of reassure the brain and say, brain, thank you for the concern. Thank you for looking out for me. I appreciate the heads up or that little red flag warning, but actually there is no evidence or enough concern to support suffering in this moment. So just looking for evidence can be a helpful activity to engage in and realize that perhaps the anxiety is unnecessary and coming from perhaps an irrational sense of threat or an overestimate of the likelihood of harm coming to us. How we know that anxiety is moving beyond a normal emotional experience and toward an anxiety disorder is when the anxiety is causing functional impairment in our lives. So this is sort of a term we have in our diagnostic and statistical manual to diagnose mental health conditions, is does the emotion cause such a high level of distress that it's causing functional impairment? And that means that the emotion is interfering in your life in a detrimental way, whether that is reducing your ability to achieve your goals, making it hard to go to school or work. Perhaps it's affecting your relationships and holding you back from building healthy community or friendships. So we really have to look at anxiety as an emotion, but also be curious about how it's impacting our overall life and identify any areas in which it's causing us some functional difficulty where we're really not able to function at our optimal level or achieve up to our potential, or holding us back from some freedom of some kind. So I always will advise the kids that I help to say, if you could kind of wave a magic wand and make anxiety go away, what would you really want for yourself? So for example, if a child has some performance anxiety, maybe it's in athletics, we would recognize that that child really does have a passion, a drive, an interest in playing sports. But because they're so hard on themselves and they have some perfectionism or performance anxiety, usually rooted in, what if I don't do well enough? People see my struggle or failure. People will have negative judgment of me. And then they may not like me. They may not want to be my friend. So often we'll dig down into the so what. Well, so what if you have a bad game of basketball? Well, people might judge me. Well, so what if they judge you? Why do you worry about that? Well, they may not like me. Well, so what if people don't like you? And very often when we break down anxiety with these so what questioning, we will realize that at the core of a lot of our anxiety is this fairly shared human fear of what if I'm not good enough? What if I don't have enough worth for the tribe to accept me and want me? So this is somewhat biologically based in that it really was essential to have acceptance and to not be rejected by our tribe, because back in the day, if the tribe cast you out, you were pretty much doomed. There weren't a lot of options to go find a new tribe. And that's not relevant in this modern era in which we can move to a new place and start over socially, but there's this biologically wired fear of our self-worth tied to a sense of rejection that people may not think that we are worthy of being accepted and kept as part of the tribe. So we'll often need to break down the fear and say, what's really going on here? Anxiety disorders seem to be increasing over the last several years, even before COVID. We really are seeing a lot of teenagers have overwhelming anxiety, and that seems to relate some degree to social media use. So social media, unfortunately, inherently makes us go into social comparison. And we also know that through social media that people tend to promote this almost artificial best impression of themselves, their life, their highlight moments. And we can't help but see other people on there and compare ourselves. I also think that we're living in an era in which most people have nutritional deficiencies. We just are living in a time in which the food system is really devoid of key nutrients and loaded with lots of inflammatory chemicals and additives and toxins. And so we know that nutrition is really an important piece in overall mental health, brain function, and that most people, especially here in America, are not getting enough nutrients, or they are eating too many substances that are dysregulating their biochemistry. So especially sugar. So there's a whole lot of literature coming out showing how unstable blood sugar, having these glucose spikes and drops, kind of putting your blood sugar into this roller coaster of highs and lows, is so incredibly hard on the brain and the nervous system. I see a lot of teenagers that really live off of sugar and caffeine. They just eat empty carbohydrates. They drink energy drinks and soda and sweet coffee, and they're just trying to fuel themselves to survive the day, but they're feeling worse and worse over time. We need to really care about how we are fueling and nourishing the biochemical needs of the brain and the body. So I have a whole lecture, pretty long talk, about the nutrients that lead to happiness. So if you're curious about some of the best foods to include in your diet to feel at your optimum, to have a more balanced stress response, a more even mood, less sense of stress and anxiety, please reference my lecture on nutrition. But we'll talk a little bit here today about some of the key nutrients to think about. So one thing is to try to really minimize sugar, minimize foods that cause inflammation, such as deep fried foods, trying to minimize caffeine and alcohol. These things are just going to deplete us over time and cause us to feel just really poor internally, really shaky inside. So we want to avoid some of those substances, and instead, the best advice I can give anybody to really maximize their health, including mental health, is to start to eat a wide diversity of plant foods. So as many colors of vegetables as you can tolerate and experiment with and get creative with adding new vegetables into your diet. Fruits are wonderful. All the different nuts and seeds have lots of healthy fats and protein and magnesium and amino acids that are our building blocks to create our neurotransmitters. So I'd really encourage you to diversify your plant choices. I do think some amount of good quality meat is okay, but not everyone's choice in lifestyle. But do be selective and try to eat a moderate amount of meat. Avoid processed meat altogether, like pepperoni and sausage and that kind of thing. And be thoughtful about trying to access meat that came from animals that were fed a healthier diet and treated with a more healthy environment and how those animals were farmed. So let's talk some about nutrients. So of course, food matters, and I would encourage you to always start with food when you're thinking about balancing your biochemistry. It may be a bit of a broken record because I'll mention this often in my videos, but it's really helpful if you can find a functional medicine healthcare provider that is able to run labs and look at your biochemistry and actually see where your unique biology might have some deficiencies in key nutrients, where are your inflammatory markers, even genetics to figure out how you might be processing things like B vitamins. And from those labs, you can get a more strategic plan about what foods or supplements to add into your diet and lifestyle and what things you might be best to avoid. For example, if you have a sensitivity to wheat or dairy or eggs or soy, it can be even helpful to know that so you can eliminate those foods for a period of time, lower your overall level of systemic inflammation, and then add in foods that will help support your biochemistry and your body's overall stability, just the levels of inflammation, digestive health, the nutrients you need to create your neurotransmitters and your hormones. So lab work can be really helpful in guiding a more strategic plan. There are many supplements that have been found to be helpful to reduce anxiety. So one thing I would always recommend people consider is taking magnesium. Again, in my lecture on nutrition, I cover a lot of these core nutrients and the foods that we can prioritize to get more of them. But magnesium is one of the most essential nutrients for mental health, and it really is a calming agent. And so there's even, I think, a product called Calm that's mostly magnesium. And magnesium relaxes the nervous system. So if you have anxiety, you're feeling just stressed out, on edge, overwhelmed, really reactive, jittery, just really uncomfortable internally, there's a really high likelihood that you are deficient in magnesium. We can test for that, but at the same time, you could just take some magnesium. It's very safe, and we know it to be essential for hundreds of biological functions in the body, including creating our hormones and neurotransmitters. So the magnesium type that is most recommended for brain health and cognitive function is called magnesium threonate. And magnesium threonate is just one of many forms of magnesium that we know is really helpful at supporting the brain and nervous system functioning and having our brain sort of in balance as far as how the brain is working. So magnesium threonate, but there are other forms of magnesium. I also think Epsom salt baths are a great way to get magnesium, and any green leafy vegetables. So if it's green, it probably has magnesium. Also, nuts and seeds are really helpful. So magnesium is something I would very easily and confidently recommend people take. Also, vitamin D3. So vitamin D3, typically added to K2, is really helpful and important in mental health and overall immune system function and preventing cancer. So vitamin D is something that most of us would benefit from. Again, if you can get some lab work done, they can check your vitamin D level, and you really ought to shoot for that vitamin D measurement to be 40 or higher, and most people are much lower than that. Other things like omega-3 fatty acids and just healthy fats, so avocados, coconuts, olives, olive oil, fatty fish like salmon, sardines. Omega-3 fatty acids are really important for the brain. The brain is mostly fat, and so when we are lacking in these healthy fats, the brain actually sort of atrophies. And we have quite a lot of research now showing that omega-3s are not only helpful for cognitive function and depression, but also for anxiety. Some other things to consider would be zinc. Also, kava has research behind it. That's an herb, I think a root actually. And kava is known to be helpful for anxiety and has some clinical trials backing that. Inositol is one of sort of in the B vitamin spectrum. And inositol is known to be a relaxant and to be helpful for anxiety, sense of stress, and insomnia. B vitamins are essential in mental health. B6, for example, is really important as a cofactor to be able to create neurotransmitters, which are the hormones that allow brain cells to communicate with each other. But I don't recommend people just haphazardly start taking B vitamins. If you are going to supplement with B vitamins, take a spectrum where it has a balanced kind of ratio of the different B vitamins kind of in one supplement. But again, this is where testing can be helpful. Some of us metabolize B vitamins differently based on our unique biology and genetics. And sometimes people have a detrimental response where they actually feel agitated and worse on B vitamins. So it's just a complicated area, but B vitamins are essential. Vitamin C and antioxidants are going to be very helpful in anxiety. So often oxidative stress in the body is a factor in why we feel poorly and our emotions and stress response are out of balance. So of course, start with food. Eat as many vegetables and fruits and colorful plants as you can. Things like resveratrol, found in red grapes or red wine, is an antioxidant, and we can also take vitamin C. But thinking about antioxidants, being so helpful for just about everything in the body, and that they support cellular function and reduce its oxidative stress load in the body. There's these things called nervine herbs. Nervine, so thinking nerve or nervous system. So nervine herbs are calming. They actually tend to support GABA production. GABA being a naturally occurring neurotransmitter that's inhibitory, meaning it calms or quiets the stress response. Some of the nervine herbs we know are helpful are things like passion flower, skullcap, milky oats, kava, valerian, lavender. So what you'll usually find are supplements that combine several of those herbs together, either in a capsule form or a tincture. And so nervine herbs can be beneficial. Also adaptogenic herbs. So adaptogenic herbs will calm the stress response, but also help with fatigue and kind of that brain fog we can struggle with. So some of the adaptogenic herbs are rhodiola, ashwagandha, and Siberian ginseng. So those are some adaptogens we know are helpful for anxiety. So nutrients matter, biochemistry matters. We want to lower the draining foods and toxins in our diet, especially sugar. And we want to add in as many plant nutrients and essential biochemical nutrients to help support our biochemistry. Those things are really important to consider. One thing to consider if you are going to eat sugar is to first eat fiber, so think vegetables first, then try to eat your protein and fats, and have sugar after. So dessert after a meal is the right way to go. And perhaps salad before your meal is also an order in which we can eat our food that will help lessen the impact of the glucose. So it'll help stabilize our blood sugar if we eat our carbohydrates or treats after we have had some fats and proteins. So these are all little tricks we can do to still enjoy some treats, but be more strategic so they don't spike our blood sugar and cause that crash in which the nervous system can come out of balance and create unnecessary anxiety. Sleep is also very important, and often it can be hard to sleep when you have anxiety. That's where relaxation skills are so important, including breath regulation. But also sometimes we're just not honoring our need for sleep. So, be honest with yourself and recognize, do you have a set bedtime? Do you have a commitment to trying to make sure you have a good 8 hours in bed, lights out, no screens, no TV, and just trying to rest and relax throughout an 8-hour period each night? So work on those commitment to a bedtime, a wind down routine, always thinking about bright light in the morning, as much sunlight as you can get, and dimming the lights in your home in the evening to help initiate that melatonin production. I have a lecture on sleep out there, and if you want to learn more about perfecting your sleep, I'd recommend you check that lecture out. So sleep is so important in reducing anxiety. Also, exercise. So I believe one reason that anxiety is becoming more problematic is because humans are becoming more sedentary. So we used to have no choice but to work physically hard every day, pretty much all day during daylight hours. And what happens when you physically work is you fatigue the muscles. When muscles are tired, you feel relaxed. So you might think about a day where you had a big workout or went hiking or walking or swimming, and how that night you might feel, more relaxed, more at ease in your body. And some of that is this kind of bottom-up messaging. If your body is tense and restless, you've been sitting all day and there's all this tension, then your brain might misinterpret that as threat. But if you've been moving throughout the day or had a good workout and your muscles are actually tired and kind of at ease, your brain will interpret those tired muscles as safety. If your muscles are relaxed, your brain assumes all is well, that there is no danger in this moment. So exercise is so powerful at mood regulating, very helpful for depression, but really essential in anxiety. If you find yourself in an acute anxiety attack, one thing you might consider is going for a brisk walk. So there's a little bit of a trick to the brain if you go walking at a bit of a quick pace, eyes on the horizon, so we don't want to be looking down and stuck in our thinking brain, but rather very aware of the visual world around us, eyes on the horizon, walking quickly, hopefully synchronizing breath with movement. And what will happen is that you sort of trick the brain into thinking, well, if there was any danger back there, I'm moving away from that to here. And walking actually has been shown to be really helpful at managing anxiety and coming out of anxiety attacks. So physiology, right? Sleep, nutrition, movement. How about coping skills? So we can't avoid talking about breathing techniques if we really want to master anxiety. How you breathe is dictating the level of stress in your nervous system at all times. So if you have become a chronic mouth breather, that is causing you to breathe from mouth to chest, up and down. The upper lobes of the lungs are nerve endings linking to that sympathetic nervous system stress response. We really are meant to breathe through the nose. The diaphragm drawing down as we inhale through the nose, breathing into the lower lungs. As we breathe out, the diaphragm relaxes back up. So the lower lungs have nerve endings that signal safety. They relate to the parasympathetic relaxation response in the nervous system. And so we really want to make sure of anything else with breathing that we keep our mouth closed as much as possible and retrain the body. If we've lost that capacity, retrain ourselves to breathe through the nose, belly relaxed, diaphragm moving the breath up and down. So that really is essential. We have this cue in mental health work often of you have to take a deep breath to calm down. When people are told to take a deep breath, they often go, and they lift up and they breathe into their chest and they exhale. So they do this up, down, mouth to chest breathing. And then people will say, I've tried doing deep breathing, that doesn't work for me. Well, it's because they weren't taught how to breathe correctly. So when we take a deep breath, what that really means is breathe through your nose and draw the breath low in the lungs. Belly will expand on inhale, relax back on exhale. And rather than saying take a deep breath in, we should cue people take a slow breath out. So we actually calm the nervous system on exhale. On inhale, heart rate will speed up. On exhale, heart rate slows down. So to come out of anxiety, don't even worry about your inhale. Focus on exhaling. Breathe out completely, slowly. The next inhale will just happen. Do try to breathe in through the nose and then exhale fully and slowly. If you can extend the exhale to be almost twice as long as the duration of the inhale, that creates a real safety cue that helps bring you out of that sympathetic stress reaction. There's cool research now on what's called the physiological sigh. I learned about this through Andrew Huberman's podcast. He's a neurobiologist from Stanford, and they've been studying breathing techniques to see if you work a few minutes a day on different patterns or types of breathing, how does that affect your mental health? And what they've come to find out is the most calming way of breathing is to on purpose do this physiological sigh. This is a way the body will breathe on its own to recalibrate the oxygen-carbon dioxide balance in the body. You might have even felt your body do this if you've had a cry. If you've been crying, you might find your body do a 2 or 3 inhales and a big sigh out. So a physiological sigh means that you breathe in, hopefully through the nose. You breathe in again and exhale through the mouth. So it's inhale, inhale again, expand the lungs more, sigh on the exhale out. So this is a little bit different in which we are actually kind of expanding the lungs on inhale, but that sigh through the mouth, that little bit of a vibration into the throat is a calming stimulation. Probably there's some impact there on the vagus nerve. We know that things like humming, coughing, singing are this vibration through the vocal cords and the chest, and that vibration somehow affecting the vagus nerve and creating more of a relaxation cue or a relaxation response where the nervous system starts to calm down. So that's another way to try to breathe and just see if that feels good to you. In the therapeutic yoga world, which of course I'm a big fan of all the therapeutic benefits of yoga, one thing that we recommend is what's called alternate nostril breathing. And this technique might feel a little bit silly because you actually use your fingers to close one nostril at a time. And what you do is you would close, say, your right nostril. You breathe out and in through your left. Close your left nostril, breathe out, breathe in through the right. So it's out, in, switch, out, in, switch. And so this helps to balance this right and left nostril breathing, which is something your body does actually automatically throughout the day. It's one of the ways your body is sort of keeping homeostasis. And so we can kind of artificially create that equal right-left nostril balance, and that has this interesting effect of relaxing the nervous system. So there's different ways to breathe, but what I would always recommend is that you breathe in through the nose. Try to keep the belly relaxed. Feel the diaphragm draw down so belly expands out. And inhale just comfortably. And then focus on exhaling, possibly exhaling with that sigh. And then if you're interested, experimenting with this right-left alternate nostril breathing. There are so many breathing techniques. You'll read about box breathing, which means inhale to the count of 4, hold the breath for 4, exhale to 4, hold the breath out for 4. So in these box breathing techniques, similarly, we have the 4-7-8 breath. We're actually holding the breath in, top of inhale, bottom of exhale. And so we're slowing the duration of each breath. You might have had a panic attack before, and if you have, you might know that what your body wants to do is breathe mouth to chest, up and down very quickly, hyperventilating. When you are in that state, it's really hard to control the breath. It's very involuntary. If that ever happens to you, just try to exhale out. Slow the exhale down. Breathe out completely. Sigh or or hum on exhale to create a little vibration. Maybe you go for that little walk in a quick pace, eyes on the horizon. Other things we should recognize is facial expression and posture. So part of the anxiety reaction in the physical body is to self-protect. So maybe arms cross in front, hands might come up toward the mouth. Again, we might be restless. And if you were to look in the mirror, you might see that you're holding a sense of terror or dread into your facial expression. And so we have choice in the body and a way to use that body to give cues to the brain that all is well. So you might do things like go to a mirror and smile and soften your eyes or even massage the tension out of your face. Try to ease your face out of that sense of negative emotion or fear that could be just kind of stuck there in the emotion. You're not aware how your face is reacting. So look in a mirror and do what you can to relax tension and any look of misery from the face. Rather than being in self-protective posture, really work on this high-powered posture. So in high power, we have cortisol come down, testosterone come up, and kind of thinking superhero, realizing that if you want to feel confident, brave, empowered, then you need to stand and hold your body in space as if you are confident and empowered. The research out of Harvard, their conclusion was you have to fake it till you become it. When you have a big challenge coming up, hold your body in high-powered posture, and you'll change your biochemistry, you'll calm down any sense of fear in the brain, and you'll perform better. Over time, that is who you will become through practice. As a therapist, I'm always teaching my clients self-regulation coping skills to calm themselves down when they're in a stress reaction and be able to turn back on their smart brain so they can choose their response. I always ask my clients to practice their skills in calm moments a little bit each day. But as life goes, we tend to forget until something bad happens or we get really distressed, and then we are desperate to feel better. If you've not been practicing coping skills in easy moments, it's much harder to know how to use that skill effectively in a tough moment. So I'd really encourage everybody, if you are prone to anxiety, make a list of some skills you want to really get good at. So one thing you might work on is your breathing techniques, and make a commitment. You might even put an alarm in your cell phone to remind you, or a sticky note on your bathroom mirror, or something in your car, a little note like, hey, when you're at a red light, pay attention to your breathing. And try to practice a little bit of intentional, self-regulating breathing in easy moments. What will happen if you do this is that skill will get ingrained as a habit or almost a reflexive response to self-regulate. So rather than having to think about breathing and how you're supposed to breathe to calm down, your brain will already know the technique and what it feels like to breathe in that way. When physiological stress is hitting, your brain will almost reflexively want to self-regulate, and you'll breathe sometimes intuitively without even choosing to do that on purpose. So practice your coping skills in easy moments, get very familiar with them, and then they're going to be more effective and really more available to you if you're experiencing an acute moment of anxiety. That is also true for cognitive work. So one thing is to be aware of automatic negative thoughts and patterns of worry, but another thing to do is to rehearse strong, positive, intentional coping thoughts. So recognizing what is versus what ifs, right? So what is real? What is the evidence? Sometimes we just need to label it anxiety and say, this is anxiety showing up. I'm familiar with this sensation. I know this pattern that I go through. And then step aside and look at it and talk yourself through it. This is just anxiety. It's not dangerous. There isn't any evidence of danger. I was just having worried thoughts. I've been through this many times. Anxiety will peak and plateau and then come back down, right? So we're not going to stay in anxiety indefinitely. The brain wants to come back into a balanced place. You're wasting a lot of your body's energy and resources if you're stuck in a stress response. So ideally, the brain is looking for cues of safety and wanting to come back into a balanced physiology. So even if we do nothing, anxiety will peak and subside. But we can on purpose make choices that will help the anxiety not get as intense and pass more quickly. So we can lower intensity and duration through intentional response and using coping skills. But we have to be aware to be able to do that. Awareness is going to be at the foundation of everything I teach. Without awareness, you have no power. We have to become curious about our emotional patterns, our vulnerability of when those emotions show up, our cognitive habits or brain cell pathways of automatic negative thought. Be willing to identify those thoughts and resist them and redirect the mind to different thoughts, evidence, present moment awareness, strong positive thinking. With anxiety, it's often helpful to see yourself at the finish line of that challenge. So instead of being worried about going to the dentist, see yourself walking out the door. You're done. You got through it. Even if there were uncomfortable moments, it's in the past. And focus on that finish line. For parents worried about your children, see your children grown and healthy and well, and just sort of focus on that point in the future in which ups and downs along the way, whatever, you see them as an adult, healthy and doing well in their lives. So we always want to go just beyond the what if, dread, and worry and say, well, how could this pan out in the end, and look to that finish line. If you struggle with anxiety and you become aware that you have avoidance habits in your behavior, it's essential that you start to commit to little baby steps towards facing your fears. So we can't just think our way through anxiety and try to self-regulate without actually proving to the brain that certain situations are in fact safe, or safe enough that they're not a threat worthy of false alarm anxiety reactions. So we can call this a graded exposure or desensitization. So whatever your particular anxiety triggers or stressors might be, you need to commit to your ultimate goal. I would like to be able to, maybe it's go out on a date or apply for a promotion at work or public speaking, whatever the goal might be able to see a dentist. Whatever you've been avoiding, you have to identify where you've lost your freedom and an ultimate goal at getting your freedom back and being able to handle that particular situation. So while the end goal might feel out of reach and really challenging to approach right now, what we want to do is start to have this sort of ladder of baby steps of little things we can do to start facing our fears, to prove to the brain that in fact, when I approach this thing that feels threatening, nothing bad happens. So for example, I've worked with a lot of clients that have social anxiety in which they really struggle to talk to people face to face. Presentations in school, speaking at a work meeting, even making new friends. And so what I might have them do is start by calling a store out of, the phone book. So you might think, I'm going to call Home Depot and just ask them a question. Do you sell this item? Are you open tonight? How late? And practice being on the telephone and speaking with a stranger. But it's just an example of one little baby step towards interacting with people that might give you a little bit of anxiety, but not too much. So the goal in exposure therapies is to push yourself past your threshold a little bit, but not too far. So we want to take on a challenge in a baby step where we know that our anxiety might elevate a little bit, but we won't go into a state of panic or anxiety attack. So if we think about a subjective unit of distress rating, so we call that a SUDS rating from roughly 0 to 10, and a 0 means that's easy for me, I don't have any challenge with that. 10 means I would totally freak out if I had to do that right now. We want to push our distress level subjectively around maybe a level 3 or 4, maybe a 5, but not so far that we're going to really suffer. So as you identify little baby steps of facing your fears, little behavioral exposure exercises, you want to prioritize the ones that feel challenging but doable and work on that until you find that becomes pretty easy. So face that fear, challenge yourself, use intentional self-regulation skills, know how you're breathing, talk yourself through it with strong positive coping thoughts, keep your body as relaxed as you can, and through that awareness and intentional coping, hopefully you'll feel that little bit of anxiety come on and settle down. And then your brain that at first went into that challenge kind of, I don't know, I'm not sure about this, your brain will have to have a corrective learning. Your brain will then realize, oh, nothing bad happened. I guess that was an unnecessary stress response. There isn't danger doing that particular behavior. Once that behavior, that skill becomes easier, then we're going to move up the ladder to a harder behavior. So we're going to pick our next goal or activity that is a little bit more difficult. And again, we want to be able to keep our anxiety at a medium level and stay with that challenge until it starts to peak and subside. Once the anxiety is coming down, the brain is having some corrective learning. It's reversing that false alarm expectation that that activity is a threat. So think about facing your fears little by little, step by step, hopefully almost every day, pushing yourself a little bit out of your comfort zone, and then realizing progress over time. Celebrate your successes, be really proud of you taking on one of those scary challenges, and stay committed to that end point, that intention of the anxiety being in the past, no longer impacting your life or taking away your freedom. So if you are somebody who struggles with excessive or false alarm anxiety or panic attacks, phobias, even trauma, what's so important to know is that there is biology at play, and you can make self-care choices and lifestyle changes that can help support your biology healing at the root cause. What's really neat in this era is the ability to look at the brain and do brain imaging research to see the neurology behind different mental health conditions and the process of healing. So if you have an anxiety disorder, chances are, if we were able to look at the brain, we would see that your amygdala has too many cellular connections and is sort of overly active. It's kind of lit up, ready to react at any given time. Through cognitive behavior therapy, so that's learning to be aware, change your thoughts, choose intentional behavior and coping skills, learn to choose response to manage anxieties very intentionally. What we will see is that the physiology in your brain starts to change. So we can actually measure and see the amygdala shrinking, physically reducing cellular connections and quieting down so that the amygdala is only reacting and going into stress response when there is actual evidence of threat or a problem in front of you. So please, if you have anxiety, be optimistic. You are not broken. You are not stuck with this emotional pattern for life. We know that you can influence your brain structure and nervous system function through intentional skill development, behavioral responses, coping skills, and over time, you can rewire the brain and nervous system away from false alarm patterns of anxiety and towards a balanced stress response and a balanced biochemistry. So have self-compassion, be kind to yourself in this present moment, but set your intention. Have this more long-term view of the person you want to become, growing in inner strength, confidence, self-awareness, and having this diverse toolkit at your disposal that will be there when you need it to help you self-regulate and come down from a false alarm stress reaction. So anxiety is part of life. We really need it. It's essential, actually, to our safety and survival. What we don't need are false alarms. And that's where we have to each do our own individual work to be curious, study our patterns, our reactions. Notice if anger is the surface emotion that shows up when we're actually feeling anxious. Get to know the sensations in the body and be able to identify that as, this is anxiety. I know this feeling. Get to know the thinking mind and choose new ways of thinking that can help you move through anxiety more effectively. It's so important to take care of ourselves through nutrition, sleep, movement, ongoing mindful awareness practices, and of course, intentional breathing. So these are some tools to help you really overcome anxiety at the root cause, actually understanding where you can heal anxiety and live with freedom and optimal mental health. For any of you parents listening, my next video is going to focus on how to become a therapeutic parent if you have a child who struggles with anxiety and become very strategic at helping your child overcome their anxiety. Thank you for joining me at Root Cause of Happiness. If this information was useful to you, please share it with others seeking knowledge and tools for resilience. It is a meaningful contribution to the world when we become proactive in our healing journeys, by learning and growing, by increasing our awareness, by addressing the root cause of happiness.